Well, in my humble opinion, the best thing that we could do is provide hormone replacement therapy, because what is very clear is that it's in the name, endocrine disrupting chemicals are disrupting the endocrine system. So imagine this, you're a young man, you were exposed to phthalates in utero via your mother. No fault of her own. She probably didn't know, especially if you were born in the 90s, right? It was just a free-for-all. You were born, everything's hunky-dory for the most part. You're not destroyed. I mean, it's not like you're like falling apart. You have some amount of testicle that's still functional, and you'll grow, and that'll continue to grow with you. But when you're in your teens, you're kind of depressed, and maybe you're anxious. Maybe you don't have a lot of drive and motivation. Maybe you're developmentally not delayed, like, oh my gosh, it's so obvious, but like, you don't grow a lot of hair maybe on your scrotum and groin area. Maybe you don't grow a lot of hair on your armpits, and maybe you're never growing a beard, and maybe your musculoskeletal system is kind of lacking, right? Maybe you're kind of frail or kind of skinny. Like, those are the things that I see with my own two eyes in my male patients. I also see abnormal weight gain. I see them with a lot of this, kind of truncal central obesity, almost like a Cushing's type of disease. And in fact, I note this literally in the HRT University Master Course, how there are men who appear to have what looks like Cushing's disease, and women kind of have the same effect too, and it kind of looks like PCOS for them, but for men, it kind of looks a little bit more like Cushing's disease or syndrome rather, and it really is to some degree, because they have such little amount of androgens. They have such little amount of resiliency to stress and inflammation and things of that nature. Well, then they have chronic cortisol exposure, which, influences more estrogen. And again, I'm not going to divulge into that too much. It's in the master course, but it's important to understand this kind of trickle down effect. And over time, what we're going to start seeing. And so for these young men, what do we do for them? For these young women, these beautiful young women, what do we do for them to help them? Because, well, we can't go back in time and, find a way to not expose them to these endocrine disrupting chemicals. We're also being, they're currently being exposed to them. We can certainly limit the exposure, but the problem is some of their endocrine producing cells are permanently damaged. Others are the receptors are so destroyed and distraught from these endocrine disrupting chemicals, causing what appears to be like an androgen resistance or progesterone resistance, sorry. That's not dissimilar to type 2 diabetics. Okay, and by the way, guys, I'm not making this up, this is in the literature. Google progesterone resistance. The amount of studies you'll find is fascinating, and it kind of makes sense, right? If we have insulin resistance, well, why couldn't we have progesterone resistance? Whereas, potentially you produce enough insulin, right? I mean, a type 2 diabetic is not a type 1 diabetic. Their pancreas still works. They produce insulin. In fact, they produce a lot of insulin, and yet they don't seem to receive that signal very well because their receptors are resistant to insulin. When you're insulin sensitive, all of a sudden those receptors wake up and respond to that insulin. However, if you're severe enough type 2 diabetic, we'll actually start giving you what? Insulin. We'll start giving you insulin, more insulin, to kind of help overcome that resistance. And by the way, I know that seems like a terrible last resort, but my goodness, if you're in that position, insulin, bioidentical peptide hormones, well, probably one of the best things you could do for yourself and for your health to stay on the narrow path of health and wellness. So the idea then exists too for young women and men with progesterone resistance or maybe androgen resistance because of this exposure. Now, here's what's also true. We can improve upon those things, okay? By limiting the exposure, we can limit the amount of receptor fatigue, essentially. I know that's all very loose, guys. This is somewhat theoretical to some degree, but again, if we're talking about resistance, well, there must be some amount of these receptors just getting fried, just getting burnt by constantly being received onto by chemicals that look kind of like hormones, like xenoestrogens, but are not in fact hormones, much like birth control. is also a xenotype of estrogen or progesterone. It's what I mean by xeno is not from the body, it's from somewhere else.